everyone, this is Unit 8, Lecture 5, all about neurodevelopmental disorders. This used to be its own category called developmental disorders, but now it is actually part of a larger neurocognitive label, and this is one that focuses specifically on the development of children. So you're noticing lots of words that you feel comfortable with at this point. So neurodevelopmental disorders in general involve distortions or changes in the development of basic psych functions that are needed or utilized in social skills, language, perception, motor behavior like physical movement. And these are usually diagnosed during infancy, childhood, or adolescence, depending on which one we're talking about. And that may help you understand that these changes typically are something that the child is born with, either because of a genetic change or perhaps because of something that happened to the child when they were still in utero. The first one we're going to focus on is autism spectrum disorders. Typically, these are identified as showing unusual patterns of social and cognitive development beginning in childhood, typically around 3, but it can start to show itself even earlier than that. One thing that people look for are difficulties in social interaction and communication. There can be an intellectual disability that goes along with it, but that only occurs in about 70% of those with autism. So it is not something that is a required symptom of autism to be diagnosed with autism. There is such a huge variety of symptoms and types and severity of symptoms that while autism at one point in the DSM-4, I believe, was broken down into 5 different types, it is now seen as a spectrum that includes both high and low functioning individuals with these certain characteristics. An example of a type of a high functioning autistic person is someone with Asperger's syndrome, or what would have previously been labeled as Asperger's syndrome. This is more frequent in males, 4 to 5 times more likely, in fact. Autism spectrum disorders are diagnosed with 2 categories of criteria: social communication interactions and restricted and repetitive behaviors. In order to understand what that means, let's take a look at some characteristics of autism spectrum disorders. First of all, impairment in social relationships. And this is extreme because in extreme autistic cases, there is a total lack of awareness sometimes of the existence of other people. And even if they understand that other people are there, they are unable to read or gauge the feelings of others. You can sometimes tell through the fact that they don't like to be touched or held. They may avoid eye contact with other people. They may prefer solitary play. This even goes so far as not liking affection, even by their mothers. They might have impaired speech. About half of autistic children do not develop speech at all. And what speech they do develop may be more like an echo of either something they just heard someone say or a catchphrase from a movie or TV show or commercial that they've kind of latched onto and repeat perhaps over and over and over again. They often show a very narrow range of interests and activities, become perhaps fixated on a certain toy or game, almost to the point where you could call it an obsession, especially if it's with a specific object. And sameness and routine are very important to their well-being. They usually become distraught or angry if change occurs. And so that change could be an overwhelming sound or smell or object to enter the room. So if you think way back to, I guess, Unit 3, but we've talked about this a couple of times, to the ability of humans to choose what to focus on. While there might be many sensations around them, smells, sights, sounds, different feelings of touch, someone with autism, they may not be able to block out that extrasensory information. They might not have a strong selective attention ability. So they can become very overstimulated very, very quickly, and this can be upsetting. So they might also engage in self-soothing behaviors known as stimming, It's short for self-stimulation. So they might engage in things like tics, rocking, pacing, spinning, hand flapping. And they're doing these things to help distract themselves or soothe themselves when they might have kind of an information overload. All of these characteristics are important to understand and recognize at a young age, because the sooner autism spectrum disorders are identified, the earlier a child could receive treatment or learn interventions. And studies have shown that children will have greater success with those interventions if they begin early on. So as I mentioned at the beginning, causes of autism spectrum disorders are likely both genetic and environmental. Research has shown a number of genes that are associated with the disorder, so there is a strong indication of a biological component. And it has shown brain irregularities in certain regions and abnormal levels of serotonin and other neurotransmitters in the brain. The next neurodevelopmental disorder I'd like to focus on is one that is very well known, and that is ADHD, or Attention Deficit Hyperactivity Disorder. This is characterized by short attention spans, distractibility, and extreme difficulty in remaining inactive for any given period. I'm going to name the 3 subtypes of ADHD. You don't need to know them, but it will help you organize the symptoms in your mind, which we're going to go through in just a second. So there is predominantly hyperactive impulsive ADHD, predominantly inattentive ADHD, and combined hyperactive impulsive and inattentive ADHD. It is estimated that 3 to 5% of school-aged children are affected by ADHD. So what do I mean by inattention? Just pick a couple of these to write down so it can help you wrap your mind around it. Because even though you may have personal experience with ADHD, for the sake of perhaps an FRQ or our tests and quizzes, we need to be really clinical and scientific about these definitions. So inattention could mean things like being easily distracted, missing details, forgetting things, difficulty focusing on one thing, the need to switch attention frequently, someone becoming bored with a task after only a few minutes, unless that thing is really fun and enjoyable to that person, difficulty organizing and completing a task or learning something new. Specific examples include trouble completing or turning in homework, often losing things needed to complete that homework, task, or activity. Things like misplacing a pencil or a certain piece of paper. A person with inattention type of ADHD may not seem to listen when spoken to, may seem to daydream, become confused, move slowly at times if they are distracted, having difficulty processing information quickly and accurately as those around them, and a struggle to follow instructions. So there is a lot of overlap of all the characteristics I just mentioned, but they all are qualities that relate to inattention. Hyperactivity is marked by fidgeting or squirming in one's seat, talking nonstop, dashing around, touching or playing with anything and everything in sight, having trouble sitting still during dinner, school, and story time, and having difficulty doing quiet tasks or activities. In other words, if they are of this type, they need to constantly be in motion. Finally, impulsivity. This is a type of ADHD that involves being very impatient, blurting out inappropriate comments, showing emotions, or acting without restraint or regard for the consequences. This quality of ADHD might show difficulty waiting for things that they want or waiting their turn, and often interrupting conversations or other activities. So again, lots of overlap in these different characteristics or symptoms or criteria, whatever you want to call them, but hopefully some of these descriptions give you some concrete ideas in your head of what is meant by these terms. Because we might know a word like impulsivity that is part of personality characteristics, but at what point does it become an abnormal disorder? And remember, that's when things might be dysfunctional, deviant, distressing to the person experiencing it, or dangerous, and altogether unjustified. So if a child is experiencing one of these or is demonstrating one of these behaviors, if it's justified behavior, it's not necessarily something to be concerned about. Just like some of the other disorders in this lecture, the causes are a combination of genetic and environmental factors. Treatment often involves stimulant drugs such as Adderall, Ritalin, or Concerta. Now, here's what's interesting. You might be scratching your head right now saying, why would stimulants be used on an impulsive or hyperactive child? Well, stimulants are known to release which neurotransmitter? Dopamine, okay? They increase the dopamine levels in the brain. And dopamine is also associated with motivation, pleasure, attention, and movement. So these stimulant drugs are meant to boost concentration and focus while reducing the hyperactive and impulsive behaviors. The problem is that while they might improve the symptoms and have a calming effect on the child or adult, because ADHD does exist in adults as well, and sometimes isn't even diagnosed until one is an adult. But anyways, while the treatment does help improve the symptoms, it can often have adverse side effects like feeling restless or jittery, difficulty sleeping, loss of an appetite, headaches, mood swings, irregular heartbeats, which can be a little bit scary, depression even, and dizziness. So this is definitely something that takes some fine tuning and a partnership between parents, child, and pediatrician, or later a doctor if the ADHD symptoms continue into adulthood. People with ADHD also may, but not always, have other disorders such as learning disabilities, oppositional defiant disorder, conduct disorder, which I'm going to recap in just a second, anxiety disorders, depression, or bipolar disorder. Now, it's important to note, one of these disorders does not cause another disorder, but the symptoms of one might make the symptoms of others more noticeable and severe if the individual does have ADHD in combination with one of these other disorders. Before I wrap up this lecture, I want to recap on two disorders that are associated with antisocial personality disorders. So go back to lecture 3 notes for a moment and take a look at what you wrote down for oppositional defiant disorder and conduct disorder. Both of these are actually neurodevelopmental disorders. So they actually do belong in this category that we're talking about here. However, they are seen often as precursors or early indications of antisocial personality disorder. Now, just because an individual has one of these doesn't mean they automatically will get antisocial personality disorder. It's actually easier to look backwards on, since that can't be diagnosed until one is 18 years old. But as one is being diagnosed with antisocial personality disorder, there's often a trend that they maybe had one of these disorders as a child. So I just want to recap what they are. In ODD, behavior typically starts by 8, but could start earlier, as early as some preschool years. And really what makes, like, all children act up, all children often try to defy the adults and authorities in their life. But what the diagnostic clinician is looking for are patterns that are unusual or different from peers, so other children in the same age and developmental levels. The symptoms must last for at least 6 months, and some include actively not following adults' requests, being angry and resentful of others, arguing with adults, blaming others for their own mistakes, having few or no friends, losing their temper, seeking revenge, or being touchy or easily annoyed. It is thought that these are caused by a combination of biological, psychological, and social factors. The next one is conduct disorder, which should sound even more like antisocial personality disorder, because this is characterized by being impulsive, being difficult to control, and being unconcerned about the feelings of others. And so remember, antisocial personality disorder is marked by a complete lack of empathy or remorse for negative interactions with other people or destruction of objects. Here, conduct disorder, now this is marked by childhood, so antisocial personality disorder cannot be diagnosed until someone is 18. But here, a child might break rules without apparent reason, so maybe stealing, fighting, that sort of thing, cruel or aggressive behavior towards people and animals, destruction of property, things like vandalism, setting fires, breaking and entering, Heavy drinking or heavy illicit drug use, lying to get a favor and avoid obligations, very similar to that con artist characteristic of antisocial personality disorder. Running away and truancy as early as 13. Someone with conduct disorder may go on to develop personality disorders, as I've mentioned, and if these behaviors worsen, they may develop significant drug and legal problems. So one last time, I mentioned these two disorders because they are actually neurodevelopmental disorders, but feel free to check back on your notes of antisocial personality disorder to see the connection.